started the meeting and I will call the meeting to order. It is 6:06 p.m. on February 5th. Our first item of business is approval of the minutes. We actually have two sets of minutes, one from December and one from January. Do we have a motion to approve the minutes as written?
So move for both of them.
Second.
Okay. Any discussion? Any changes? No? Okay, all in favor, please say aye or raise your virtual hand.
Aye.
Okay, the ayes have it. We will move to our next order of business, vacancies. So Dr. Ruddy, of course, had stepped down. Dr. Wingert, our vet, had stepped down earlier also. Believe last August, Dr. Wingert stepped down. Just this last week, Dr. Muehlman contacted me to say that unexpectedly he was moving and he'd be moving out of jurisdiction, so he needed to step down. So we are down a physician, down a layperson, and down a vet. The council members have also been advised of this and asked to assist in recruiting efforts. But I am also letting our board members know, if you have anyone that you believe you can convince, those are our current openings. I can also send out again the links to apply, to become members, and who are looking for.
Sorry. Go ahead, Jason.
Okay, yeah, one of my questions for physicians is, I mean, there's so few physicians that live in Independence. There's a rare physician that practices in Independence unless they're employed by a hospital entity. So have they ever thought about broadening the criteria of qualifications for a physician?
So right now, the members just need to either work in Independence or live in Independence. So if they work for a hospital in Independence, if they work for Centerpoint, that works. If they work for a private practice here in Independence, that works. If they have their own practice, that works. They can be retired. They can be currently practicing. All of those things will count towards the requirements for this. Any other questions?
Which, I mean, in my case, almost every physician I know does not either live in Independence or practice in Independence. So that's going to be a challenge.
Jason, did you have a question?
I did. Well, I did get a nudge, and I don't know where you're going to update us on the letter we sent in and where the city's headed with the status of the health department. But I did get a nudge from a council member who commented that we were short 3 board members, and I've been encouraging them to realize this body could review I'm hopeful of an RFP for a consultant and then engage with them, and sort of their response was, well, we need to make sure we get the board full. So it's the diversity of a membership of a board is applied to this effort that I think is about to come forward. And I thought that was a good comment. So, but I share the same. I haven't thought about it, but nothing jumps to mind, but guess we'll have to work on it.
Okay, there's no further discussion. The next item on the agenda is the department update. I do want to say, of course, we did share the letter with the council. And then it was also an information only item last night on council agenda. There was no public comment on it. I am still waiting to see how that moves forward. I know Councilmember Dr. McCandless wasn't able to join us this evening. She was going to try to join, but she had a conflict at this time right now, so she was going to try to hurry and jump on if she can. She might have a better knowledge of where they're going with this. Or Jason, it sounds like you might have a little bit that they're trying to fill the board first.
I don't, I didn't take it that way. But the comments I've heard from three of them were positive. So I have not been direct in, okay, are we moving forward with an RFP? Yes or no? I was just accepting the general supportive comments as indicative that they were directing the city manager to find the funds to do the assessment. So I take it from your comment, you've not heard anything from city management, and we need to be more direct and explicit in our inquiries.
You are correct. I have not heard any additional information being passed down about their next steps, if any, that they have.
Might I ask, are you all, is the department remaining in the structure that it was last year? Is that conversation, where did that end?
That is unclear right now. So as of now, the structure remains the same. I do not know if that's going to be going forward. There are still a lot of pieces and nothing has been finalized. So
I
we'll see as
reached
we
out
move
to a
forward.
couple of folks fairly directly, and I was very pleased with the reaction of one after the discussion, and the other one, his comment was they thought the only thing in question was where they were going to move you all to. So I assumed that was resolved. So just for the benefit of the board, there was some rumors about my words, not anyone else's. There was some intention on behalf of some in city management to go ahead and gut out the health department while before we even had the consultant come in and an evaluation of services needed and best way to proceed with offering those services. I strenuously objected to that, to two of them, invoking communication, and I just told you the response. So I know we're recorded here and respectful for the board, so I'm speaking for myself and I'm not inferring I'm speaking for the board, but I didn't appreciate the games on behalf of the city management because clearly we were working above board and recommending a consultant and a route to do an evaluation, and to have others undermining that by trying to radically change the reassign health professionals to work for non-health professionals made no sense, and it was indicative of the games that are occasionally played in local government. So I apologize for not having followed up on the loop. I will do so, and I will report back to everybody this time. I think I got everybody's emails. Sorry, Christina, that may create a open records issue for you, but it should have been clear by now. Sorry about that.
Not a problem. I was going to ask Lauren to also just give a general update on communicable disease that we're seeing right now, because I know everybody be sick right now around there. So Lauren, I don't know what you have prepared to update.
Yeah, I've got a little bit. It is in fact respiratory virus season. So we are still seeing a decent amount of flu cases. Last week we saw 164 reported cases. For context, the same time last year, we saw 93 cases. So we're close to double right now. These are, of course, just the reported cases. So people who are actually getting tested and the doctor's offices that are reporting to us. COVID is also increasing right now. It's still lower than flu, but it is up from December. Outside of influenza, we are still seeing a couple of pertussis cases. We're managing some active TB cases, and we are seeing Campylobacter cases. That's my general CD update if anyone has any questions on that.
Could I ask a question on the communicable diseases and of course some that are vaccinations that are available? My understanding is just recently, has it come down that the health department is being instructed that polio vaccines are optional now. My understanding that's from the CDC, but is that what the health department is following? Is that advice?
We are currently following the American Academy of Pediatrics vaccination schedule. And as none of the school vaccines have changed, we are still sticking with that normal schedule. The advice we received from our VFC coordinator was just to continue with the same schedule we've always been following, and just do a little bit more consulting with parents before we do it. So we'll go through the information sheet a little bit more in depth for that shared decision making that's required to do most of these vaccines, but we have not changed how we're doing our schedule or recommendations at this time.
Okay, thank you.
Any other questions? We'll move on. New business. I don't know if there's anything anyone wants to share about any of the work that is going on. Anything else that is going on in the community that they want to share? Of course, go ahead. Anyone? Okay. Well, then that is short and easy. I will entertain a motion for adjournment.
So moved.
Jason waved his hand. I will take that as a motion. Do we have a second?
Second,
Okay.
third.
Well, it sounds like the majority are in favor. We will go ahead and adjourn. It is 6:18. You guys have a lovely evening and take back the rest of your evening. Thanks.
All right, thank you.
Bye.